Hi, this is Kirk, the Bariatric Carnivore. Well, if you're like 60 to 70% of Americans right now, you've got a lot of weight that you need to lose. You're either probably overweight or obese. And the question is, how do you lose it? Well, if you're listening to your doctor, they're going to tell you to eat less, move more, which works for about 1% of the population. It's frankly not a recipe for getting healthy. You might want to try carnivore or low carb or keto lifestyle, in which case, there are no real statistics on that one. It's not been studied as far as long-term weight loss is concerned, though it does seem to work, and it works significantly well. There's some folks from Verta Health that are following people. They've mostly been following it for type 2 diabetes, but when they put people on a keto diet, they're losing a significant amount of weight and they're keeping it off for years. So that is an approach. You could also use the GLP-1 inhibitors, like Ozempic and things like that. The problem with those is, you are injecting a chemical substance into your body that has been linked to some significant side effects, including permanent digestive issues, blindness, and some other things. Plus, the biggest side effect is where people lose their weight. Half of their weight is fat, the other half is in lean tissue. That means muscle. And when you're losing muscle, particularly as you get older, it's very tough to regrow it. And as soon as you come off the drug, many people start to regain the fat again, but not the muscle. And the problem is that you're now same weight, higher proportion of fat. So that's a problem. What's the most successful way of losing weight? Well, it happens to be bariatric surgery. That is the most success rate of all of them. About 70% of the people that have bariatric surgery are successful at losing the 60 to 70% of their goal weight, which beats anything else. The problem is you don't keep it off forever, because even with the body modification, it is a tool, not a magic wand. What happens to many people, myself included, is once, when you have 70% of your stomach removed, that takes away a lot of the hunger signaling hormone, which comes from your stomach. And after a couple of years, it starts to be released from your intestines. So you start getting your hunger signaling back. And so you want to graze because you have a limited stomach capacity. And unless you change your eating habits and you start grazing again, there's a real good chance that you're going to have some significant weight regain. And about 60 to 70% of the people that have bariatric surgery have significant weight regain. My situation was a little bit different. I thankfully, was starting to notice that I was regaining some weight. And about that time, I discovered low carb. And that was a game changer. Once I started eating low carb, I was actually able to stabilize my weight. That's really helped me cut out the grazing. About a few years after that, I discovered carnivore and gave that a try, realized that works out even better, and was able to eat until I'm full and not eat again until I'm hungry again. So that beats grazing. It takes a little bit of discipline to keep from grazing. Even with bariatric surgery, you still can't be a couch potato. You're going to have to do some physical activity. So, I lift weights, I walk, and I do other stuff, and I try to stay pretty darn active. And that's helped me maintain my weight, even though most people that have bariatric surgery regain their weight. But look, would I do it again? I probably would, based on what I knew at that particular moment. Now, I would really work on the diet side first. Going low carb worked real well. Even when I was prepping for the surgery, one of the things they do for the few weeks before you have the surgery is they put you on a keto low carb diet to shrink the liver fat and to shrink the size of your liver, get rid of your fatty liver. And I ate that diet for a few weeks and noticed a pretty significant weight loss and realized, okay, this works real well. And I almost didn't go through with the surgery, but I'd already paid for it. So I felt kind of committed to do it at that particular time. So alas, I had it. Bariatric surgery is a permanent modification of the body. I mean, I have a much smaller stomach. There's been side effects from it. Certain drugs you cannot take, or they do not work like they used to. Extended release medications don't work. My relationship with alcohol changed really significantly to the point where 6 years ago I had to give it up once and for all because it wasn't working for me anymore. It was becoming a real serious problem. So these are all issues that relate to it. You do have to change your diet and lifestyle long term. If you don't, odds of having significant weight regain go up. The people I know that have been most successful, that have had bariatric surgery, that have lost their weight and kept it off, are active. They watch what they eat. They pay attention to it. And realize that this is part of a long-term process, that it wasn't a one-and-done thing where you just have a surgical procedure and you were suddenly skinny for the rest of your life. There's no substitute for physical activity and smart food choices. Sorry, there just isn't. So there's no magic wand. There's nothing magic about it. It is a tool. So, but it's a powerful tool. And if your health is, if you've got significant health issues that are pushing on it, look at bariatric surgery as a particular tool. GLP-1s as a short-term tool to help you get over your sugar addiction, your carb addiction, may be a useful short-term tool, but it's not a long-term solution. And ultimately, at the end of the day, there's no substitute for diet and exercise with adequate sleep. Those are the three pillars to health, and you're just not going to be able to get around it. As you get older, it becomes even more significant. So this is Kirk, the Bariatric Carnivore. If you have any questions about bariatric surgery, what you can expect, if you're contemplating it and you want to make a comment, please leave it below. I read all of them. If you like this video, please hit like. Please subscribe to this channel. The more people that subscribe, the more the message gets pushed out to other people. I try to put out 2 messages a week. I will talk to you again soon.